Hello, everyone. Thank you for joining our Intro to MOTS webinar. Mary, can you hear me okay? Or Kelly, can you give me a thumbs up or something that says that everything's working? Okay, great.
I can hear you.
Awesome. Thank you. In this webinar, well, I'm getting ahead of myself. Our slides say it all. So thank you for being here. A quick reminder for, general webinar notes to keep yourself on mute unless you're asking a question. And then if you have a question, feel free to say it with your microphone, or you can utilize our chat function. We have Mary, myself, and Kelly all here that will be monitoring the chat as we go to help answer questions if folks have them. So I will get my other screen up and we will move on. So this is not our monthly webinar. If you're familiar with our MOTS emails or our new Roads Navigator, you'll likely see links to a monthly webinar. When we have monthly webinars, the first Wednesday of every month, and in these webinars, we talk about either client entry, which is our manual reporting option, or we talk about our EDI folks. So in this presentation, I'll explain what the differences of those two things are. But in the Monday or the first Wednesday webinars are really updates for providers who are familiar reporting to MOTS. And those webinars change, the content of those webinars change. For this webinar, our second Wednesday of the month is for new folks or folks who are less familiar with MOTS reporting. And the second Wednesday of the month webinars are the same. The content's the same, our slides are the same. We tweak some things when we see that we need to add information or take information out. But overall, the information is the same. So if you were at the last meeting, the intro webinar last month, this one will be identical. And I don't fault anyone for not knowing that or thinking this is the update webinar. I understand that risk when I made it on a Wednesday, but I figured if Wednesday is a familiar day for people, then maybe it'll work out. So if you're in this webinar by mistake, no harm, no foul. You can leave the webinar and we won't come after you for anything. But I'd just like to give that warning because I know it can be confusing. So the general purpose of this event is to introduce you to MOTS reporting. If your organization is new to reporting to MOTS, or if you as an individual are now responsible for MOTS reporting, maybe the person who was doing it left or got a promotion, and so now you're responsible. So we're just really going to go over the basics of MOTS. We're going to meet a couple of the MOTS support team members who are here with us. We'll discuss what types of data is submitted to MOTS, what it's used for, who's responsible for reporting, the different ways that providers can report data. And then Mary is going to walk us through our MOTS portal and do a couple things to show you what the portal or our manual entry looks like. And then we have some helpful links that we'll be getting out in the chat. And of course, this webinar is really for you. So if you have questions, don't hesitate to ask them. We're all here and ready to answer your questions. So this is a brief screenshot of our MOTS support team. We have a lot of people behind the scenes working really hard to make sure that providers understand what data is expected of them. And then we have folks who are responsible for so many different facets of MOTS. So I am on the far left of this slide. My name is Kayla Camelli, like I mentioned. I'm the MOTS system administrator. And we have Mary, who's in the middle of this slide here today. And we have Kelly, who is our roads communication analyst, who are here today. And I'm going to hand the microphone to Mary to introduce herself real quick, and then Kelly after that.
Okay. Good morning, everybody. My name's Mary Hurley, and I'm part of the MOTS/Roads support team. And along with Cecilia Lobby, we monitor the MOTS support mailbox, and we help people get set up with P numbers, help set up new agencies, facilities, answer questions that you might have about entering clients, updating users and contacts, and all the things to help you so that you can report information into MOTS. And I'll turn it over to Kayla or Kelly, one of those two, to introduce themselves.
Yes. Hi, I am Kelly. I am the Rhodes Communication Analyst and do communications for MOTS as well. So any newsletters or emails, those will be coming from me, and also training materials and anything like that. I usually have a hand in that.
Thank you, Mary. Thank you, Kelly. Yes, as a general reminder, there's so many people working on MOTS. There's a lot of people there to support you. We'll post the MOTS support email in our chat, and that's really the main way to get a hold of us. But we have a lot of people here supporting providers in any way that we can. So I can get started here. So the MOTS organization, you'll hear us say the word agency and the word facility. In the real world, I think those two terms can be interchanged. In the MOTS world, they mean slightly different things. An agency, I like to think of it as like an umbrella. And an agency can have many facilities, but a facility can't have many agencies. So for my example, this little graph that I'm showing shows on the right side of the slide, you'll see Kayla Therapy Solutions as an agency, and then Kayla Therapy Solutions as a facility. So if you have one place where you do business, your agency and your facility will be identical. And that's really because if for any reason your agency expands and has a new location, then we can add that in. So it'd all be under the same umbrella. And then you'll see that on the other part of the slide, we'll see Aspen Therapy Centers. I don't know if that exists. I made that up for this slide, so I hope it doesn't really exist in real life. But we have 3 different locations. The agency information can be the same as one facility, like those are identical. So it can be identical with the same MMIS number is how we track MOTS providers. But any additional facility needs to be a separate MMIS number. And MMIS is our Medicaid payment system number. These are examples of how agencies and facilities can be. This is typically what I see, but we are open to making the organization in MOTS something that is beneficial to you as a provider and fits the needs of your organization. So if this is something that you're curious about or you have questions about, feel free to ask them in this. Well, we probably won't be able to get into a deep conversation in this meeting about it, but we can definitely schedule a time to meet up with you to discuss what would be best, a better fit for your organization in MOTS. And I don't even think I ever gave uncoded our acronym. MOTS is the Measures and Outcomes Tracking System. I think I had it on my first slide, but I don't think I said it out loud. So that is the system that we're going to be talking about today. MOTS, the MOTS system collects a lot of different types of data. We generally right now are collecting 3 different types, or we categorize them in 3 different ways. We have mental health and addictions data, mental health crisis data, and involuntary service data. The mental health and addictions data is split up into two different pieces, essentially. We have a status piece and a non-Medicaid service piece. The status piece is what we expect providers to submit every 90 days, at a minimum, every 90 days. And this is information, this is demographic information that can change over the course of a treatment cycle. So if you have a client that comes in to receive mental health or addictions treatment, we'll initially ask for things like dependence, marital status, estimated gross monthly income, living arrangement, and all of these things can change over the course of someone's treatment cycle, right? Diagnosis can change, like all of these things can change, and that's what the status updates provides us, is identifying when those changes happen in the course of that cycle. So on top of status updates, in the mental health and addictions reporting, we also request non-Medicaid services. So in combination with our MMIS system, our analytics team can kind of put together what services someone is receiving and match them up to the status information. So we can see that, Medicaid was billed for XYZ services. This is the status updates that we're running alongside those services. But we understand that sometimes during a treatment episode, someone can be receiving a service that Medicaid doesn't cover. And that's what non-Medicaid service is generally for. It is used for other things, and I can get to that in a little bit. But generally, it's to collect services that are not funded by Medicaid. Because they are still part of that overall treatment cycle, we want to still capture that they're happening and that client is receiving those services. So in the non-Medicaid service section, we ask for a procedure code, we ask for billing information, we'll ask for a diagnosis that it was associated with, things like that. Our mental health crisis information and our involuntary service information, which is generally used by the counties. And so those are our three data collection types right now. If you've been receiving any MOTS information or our Roads Navigator, hopefully you know what Roads is. Roads is our Resilience, Outcomes Analysis, and Data Submission System, which we're building right now and which will eventually replace the MOTS system. That is anticipated for Q4 at this point. And we're working really diligently to make sure it's the system that everybody needs. And a lot of this will look familiar. There's going to be all this base knowledge you're getting out of this webinar will be applicable to Roads. And the undercurrents of it are the same. Our reporting reasons are the same. The base data set that we're getting is the same. So there'll be some new things, but overall, you can feel confident that you'll at least see a lot of familiar pieces in that system. So what is this data used for? Which is a question that I ask, like, why are we doing this? Do we have to be doing it? Why are we doing it? We know that it is a big lift for a lot of organizations to provide this data. And the reason that we're requiring it is to comply with federal and state funding and or grants. The state of Oregon receives grant funding from SAMHSA, which is the federal government, for behavioral health and addiction services. In our contract with the federal government, we say, yes, we will receive that money. And they say, okay, if you receive this money, you have to give us this data set. And we call that a treatment episode data set, or TEDS for short. If you're around us state behavioral health people, you'll often hear the word TEDS. It's the data that we are all required to submit back to SAMHSA in return for that grant funding. And that's really where the bulk of our data is being sent to that we collect. There are some other state-specific reporting requirements that that push providers to report to MOTS. So things like DUI services are reported through MOTS. Any medicated assistant treatment, so MAT drugs are reported through MOTS. And I'm sure there's more. There's some housing data that gets submitted through MOTS. There's a couple other things that have been wedged into the MOTS reporting. But along with complying with state and federal requirements, we also use this information to evaluate client demographics, to monitor and report outcomes. It can assist with budget development or rate setting. We can evaluate contract utilization. So in the system, there are ways for us to see which providers are utilizing which contracts, either with counties or CCOs. It allows us to utilize and support quality management activities, respond to requests for information, and this one's analyze health system transformation measures for performance and outcomes, which is a very long and weirdly capitalized sentence that I need to address. So that is generally what the data is used for. And we will continue on to who reports the data. This is a very text-heavy slide, and I apologize for that. I wish that it didn't have to be. Generally speaking, it's mostly always true that if a behavioral health provider is licensed or has a letter of approval from HSD, which used to be AMH, and receives public funds to provide treatment services. So if you are accepting public funds via a grant from a county or a CCO or a CMHP or directly with the state or directly with another state agency to provide behavioral health services, you should be reporting to MOTS. In addition to that general statement, there are also categories that also should be reporting to MOTS that are outside that statement. So providers directly with an HSD contract, subcontractors of a CMHP, a CCO, or another entity that holds contracts with the state, providers that provide DUI services or opioid treatment providers. Those are the medicated assisted treatment I mentioned earlier. And then any provider that is contracted with another governmental agency to deliver mental health and substance abuse services. So if your organization has a contract with OYA to provide behavioral health services to the youth, that would be MOTS reporting would be required for you. And it's really so that we can track the public funds that are being passed through that line to get to Oregonians. We know there's a lot of different ways that those public funds can be split up, whether it's through a CMHP or a CCO. And then we have organizations like your organizations all over the state who will contract with the CCO or a CMHP to provide services for them. And that's the funding that we're looking for, and that's the stream that we're looking for. We get a lot of questions about whether someone should report or not, and I often have to tell people to really look in your contracts that you're signing with either CMHPs or CCOs or OIA, wherever you're signing a contract that says I am going to provide services, through this contract. The MOTS reporting is probably buried in there somewhere. The only contracts that I have visibility to is our CCO contracts, and it's listed there. So I assume, and I've been told that it is in those contracts, but it might not name MOTS specifically. It might say the state behavioral health reporting system, which would be MOTS, even though it doesn't say it. So if you have questions like that, feel free to email MOTS support. We get those questions a lot. But really, it's if you have a license and are approved to submit or have been approved to provide services and are using public funds, then you would be reporting to MOTS. All right, give me 1 second. I'm going to take a little drink. Okay. There are 2 ways to submit data to MOTS. We have our electronic data interchange, which we often refer to as EDI. And this method requires an EHR or an EMR. And for those who aren't familiar, an EHR is an electronic health record system, and an EMR is basically the same thing, and it stands for an electronic medical record. These are your Epics, your Ochins, your Dr. Clouds. There's a couple others that we have validated that can send us the data. And that utilizes what we call a secure file transfer protocol, SFTP. And that is accomplished through a lot of coordination with our EDI expert, Jody Kramer, and the EHR and the organization. So it's really a triangle of information being passed around through those 3 groups in order for the EHR to pull out the data that MOTS needs, put it in a file, and then that file gets uploaded into our system and ingested that way. For folks who don't have EDI as an option, we do have a client entry web portal that is our manual entry. So this allows organizations to manually enter data, client-specific data into the web portal. I am excited that when Rhodes comes up and is live, we will have some additional methods to submit data that'll help bridge the gap between those 2. We know that it's a big list for EHRs and for EMRs to configure a MOTS file. And we know that for organizations that don't have a compatible EHR, that client or manual entry can also be a big lift. And so we're working hard to make sure that there is a middle ground there that'll help bridge that gap. But I'll be talking about that a lot, probably 6 or 7 months from now. And I mentioned that we have, what do we call them? Approved vendors. So just because you have an EHR or an EMR doesn't automatically mean that your EHR is configured to send a MOTS file. These are the current EHR vendors who have been sending MOTS files. So if you have one of these vendors and you are listed to submit data through client entry, reach out to us and let us know, and we can figure out if you could be utilizing the EDI functionality that we have. And it is always possible to add a new EHR to this list. In my experience, that takes a long time and a lot of coordination. So generally, if someone says they have an EHR and they're interested in exploring adding it to this approved vendors list, I usually advise that we will start off utilizing client entry or our web portal to submit data so nobody gets behind. And if and when that EHR becomes an approved vendor, we can make that switch whenever that happens. We've had to make a couple switches from CE to EDI or from EDI to CE. So all of us are very familiar with that process. And how often is data submitted? So we learned about how, we learned about why we're submitting data, we learned about who's reporting the data, and now we're going to talk about how often are we submitting this data. So for clients, any client that is new, MOTS is requesting, we are requesting that the information gets submitted within 7 days of admission. Along with a client, a crisis event or an involuntary service event should be reported within 7 days. Medicaid is a little funky by requesting that on the fifth halfway of the month following the service date. So if I had a treatment, I had a non-Medicaid service that happened in March, I would expect that to be reported to MOTS by at least April 15th. And our MOTS client entry portal has a way to clone non-Medicaid services. So if someone is receiving a service regularly over the course of a couple months, somebody doesn't have to type in the same information, 10 times if they come into the clinic, 10 times in a month. If it's a non-Medicaid service, we have a way to make that easier. Status updates, so that's that demographic update information that I mentioned earlier. We ask that at a minimum, folks are reporting that every 90 days. And then when someone ends treatment or discharges from treatment, we ask that that information is reported to us within 30 days of them leaving. All right, it is MOTS demo time. We will walk you through a little bit of the portal, our MOTS web portal. Mary, are you prepared to walk folks through this, or would you like me to? We didn't talk about this before. So if that's something you want me to do, I'm happy to do that.
Well, I'm happy to do it. I just had to find my unmute button.
Okay,
so,
great. Well, I'll stop sharing and I'll let you share.
Okay, and looks like we've got something in the chat, so you might want to share that. Okay.
It looks like we had what does ROADS stand for again?
Okay.
Which is the Resilience Outcomes Analysis and Data Submission System. I should have a contest who can say that the fastest without messing up.
Can you see my screen?
Yes.
The AMH web portal training. So this is this portal is what we have for training. We use for training, and I'm gonna log in. This is what you normally would see. We ask if you want to practice in MOTS, let us know. We can help you set up so you can use the training or part, because we want real data in our production, and MOTS is a live system, so that anything that you put in is real. So we do not want fake information in there. We don't want fake clients. And the other thing is, like in training, we don't want you to put real clients, names or things in there. So when you log in, you'll normally see these tabs up here. And if you have an admin's button, you can see like the user maintenance. You can look for a user in your agency if you have sufficient rights to it, or maybe you want to look at your agency system, your agency profile, how it's set up. You have your agency contacts. You can add an agency contact. Here is the facilities. If you click on a facility, you'll also see facility contacts. So you can add a facility contact here. And down here, it shows like your method of submission. So we enter clients through the facility. And when you go to the client entry tab, you're going to see a client lookup screen. So we suggest that you look up your clients. So if I put in last name of Duck, and I'm going to get 2 Daffy Ducks, one with very different dates of birth, but I'm looking for Donald and he is not here. So I know that he's a new client. So I'm going to add new client. And right here, we're going to put your status information goes under behavioral health. So it says add new treatment episode. And right now, everything's grayed out and I can't click in. But so what it's looking for is the agency, and it's also looking for a facility because I have to tell it which facility this client is receiving services. So we're going to add, he came into a magnificent healer. So we'll select that. And as soon as I select that, now I can click into these boxes and start entering information. So I'm going to put a last name of Duck, first name of Donald, and he doesn't have a middle name. We were asking for last name at birth. I do not know what his last name at birth is. So I'm just going to repeat his last name and his date of birth. We'll put 09/1961 and treatment status. And here you're going to select either active or assessment only. So we have definitions of what those mean in our manual. And if you choose assessment only, you'll notice that these tabs went away. But he's going to be an active client, so when I choose active, I have two other tabs that show up: behavioral health and addiction detail. And you can see, that there's different kinds of information depending on your facility and what services you provide. You may or may not deal with addiction details. That is for those clients that you're providing substance abuse um, services for, such as DUI, or they're going in for methadone treatment. Most of you will everyone will fill out the client profile and the behavioral health detail. So now we go on to client ID. You're going to use something that is unique to Donald Duck, and it'll stay with him. You're going to choose ethnic. Let's see, he's Mexican, and his race. We're going to say he's. We don't know what race he is, so we'll just say other single race. Gender. You have ugh, three choices. I'm finding my mouse right now, trying to get the thing. We'll say that Donald is married and he's a veteran, but we don't know, not a specified branch of service. Competitive employment, we'll say that he works full time. He has a living arrangement. He lives at home. Date living arrangement changed. He's a new client, so we don't have to worry about this. But if we were to go back and do a status update and say his living arrangement changed from, like, he's no longer living at home, but he moved in with his children, his adult children, then we can change that. And there's a date that it wants to know, when did he move. So county of residence, will say that he lives in Marion County. County of responsibility, that's the county that is responsible for paying for his services. So we'll say Marion again, and then we'll go on to behavioral health detail, and we need an admission date. We'll say he came on April 1st, and we need a zip code of where he lives. So we'll put 97302. his state of residence is Oregon. We don't know his income, so we're going to put a 1 here. Or he refused to he doesn't want to share how much he earns. So 1 is for unknown. And sorts of income, we'll say wages. We're going to look for actual source of payment. He's got, we'll say he has private health insurance. um, Actually, I should say other. Um, Number of dependents, it's just he and his wife. They have no children. Primary health insurance, um, we'll say private, referred from an advocacy group, and where he's referred to, none at this. We can go in and we can change that at any time. He has no tribal affiliation. Mr. Duck speaks English, so we say no, none interpreter. He's pregnant. We'll say not applicable. Highest school grade completed. He completed high school. So we'll put 12. Does he smoke? We don't know. Substance use, unknown. Legal status. Uh, we'll just put none for now. A diagnosis. He's been having some stress. So we'll choose acute stress reaction, peer deliver services. He's informed. He's infectious disease, low to no risk. We're going to say treatment plan indicator. He's other. And he's not in for addiction details, so we're going to leave this blank. But a word about this. If you put anything in on this page, it expects you to fill out the whole thing. So if you don't deal with substance abuse clients, or you don't do DUI, or you don't do methadone, you're just better off just not dealing with this page. Because once you put something in, it's going to, you just can't fill in one box. It'll expect everything to be filled out. So now we're going to just submit and see what happens. And MOTS will tell you, because right now behavioral health detail is red, that there's something missing on this page. And I scroll down and it'll show you the boxes that it's expecting information. So if you notice up here this box is blank. It says situational. I don't need to put anything in there, but if I had put in like he was in there for like a Dewey, he has a DUI, then this would show up, his legal status. But as I put in none, the it's not asking for his Oregon driver's license. Let's see if I can put in none. School attendance, we're going to put NA. These things from when we created MOTS, we put several thorns together that were separate things in CPMS. One was for youth, one was for DUIs, one was for adult mental health, one was for adult substance abuse, et cetera. And these school attendants came from the youth form. So now we don't see any red, so we'll hit submit again. And we see that here's his admission date. His treatment status is active and he's submitted. Now let's say that he came in again on the 8th. So we click on it and we want to do a status update because now he has moved out of his home. He and his wife have moved in with his children, his adult children. So we're going to put in private residence with relative. And let's see. Now, maybe his primary health insurance has changed. For some reason, he's on Medicaid. For some reason, maybe he went on disability or something happened. So we want to know that if we click submit, now we've got something here. It's asking us date change, living arrangement is required when living arrangement has changed. So it wants to know, when did he move in? So he moved in with his children on the 6th. And we click submit. And so this shows when the last time that you submitted something for him. Maybe there's some non-Medicaid services that are being paid by public funds and you want to add some Medicaid services. Perhaps so you can put in the date of service. So April 3rd. See. April 3rd is on Wednesday. He goes in for some services, and you can put in non like here, alcohol and drug, family, couple counseling. You can put in where did it happen at the clinic. Modifiers are, situational. You can put in he had 2 units. Provider ID. We want to know who's paying for the services. So we'll just say AMHs, and then it's going to ask for a diagnosis code. And we have acute stress reaction. So that's the one that we have. it can ask for additional dates. Oh, we need a bill charged. Let's say it's $100. Add additional dates. And here's a calendar that you can click. Let's say he also came in on the 10th, and you can submit that. So here we have date of service April 3rd, and again April 10th, and same kind of procedure, same number of units, bill charged, and there's his non-Medicaid service. If you go back to the his profile, it shows here's his status information and here's his non-Medicaid services. Okay. Kayla, how's that? Is there any questions that came up or anything else that you would like to put in?
No, I think that was great. I don't see any questions in the chat. I did link a couple things in the chat. I linked our client entry training videos, which go through each section and describe or give instructions of how to use each section in MOTS. So if you are responsible for submitting substance use disorder services or involuntary services, there's a specific video that walks you through it, like similar to what Mary did. And then I also linked our reference manual and our data dictionary.
Okay.
Oh, go ahead.
Oh, sorry. I just wanted to show them, this is our web page for MOTS. And down here where it says learn more, you can find, like Kayla was, the links that Kayla put in. Here's the link to the videos. And also, if you need to find a manual or you need tips, if you click on resources and FAQs right here, you can, here is like, if you type in tip, you can, depending on what kind of service that you provide, perhaps you do rental assistance, or maybe you work with kids and youth, or you do DUI, or just in general, you have here's a MOTS tip sheet for you that goes through like the different tabs that are there and what each of the fields, just kind of like a brief summary of what we of what to put in, what we're looking for. And you may find that helpful, along with the manual, like the reference manual that Kayla provided. The reference manual has very detailed information of what is in, what we expect for those fields and why we require it, and other information. Here's a sample of the reference manual. It has like if you provide services that aren't paid by public funds but are not Medicaid, services that aren't paid by sorry, I think I need to reset the settings on my mouse because I just click and it doesn't do what I want it to do. But if you have a question, if a service that you provided, should you be reporting it as a non-Medicaid service, this diagram will help you. It's a flow chart to help you answer questions, if you just start at the top and go down to the bottom, then you'll know if you have to report that information in MOTS or not. And then there's some examples that we have down below. It's really, it depends on the type of services that your facility is, your agency is certified or licensed to provide, and what kind of clients that you see. It, you know, what we're expecting to be reported in MOTS, including your clients. So it, we can't give this answer, one answer fits all, because we're covering the whole state and we're covering all types of providers for behavioral health, for substance use, that serve all different types of population, adult, children, youth, drug, driving under the influence. We have, methadone treatment. And so, it's what you do and what you provide and the people that you see that, it all depends on that. And so we have many different resources for you to look at. And so be glad to answer any kind of questions that you might have.
Wonderful. Thanks, Mary. We got a message in the chat asking if this presentation will be provided to attendees afterwards. And the answer is yes. I will work this afternoon to get this video uploaded to YouTube, and then we will send out an email with some links and a link to this webinar so that everyone has it. And if you think that someone else at your organization would benefit from either watching this webinar or looking at those videos, feel free to forward that information on. Otherwise, I think the only other slides that I have are just our helpful links, which I put in the chat and which will be in that email. So we can let folks go. These are our helpful links, but you will see them again shortly. And then we have our emails, or my email, and then our MOTS support email, which will also be in the email that you get later today. And that is all we have for our MOTS introduction webinar. If you were expecting different information or you wish we talked about something specific, please let us know. We're always happy and willing to make sure we're providing information that you all think is useful. So just feel free to send us an email, send me an email, let me know. Otherwise, have a great rest of your morning and a great Wednesday, and we'll see y'all soon.
Thanks, everyone.